Hypertension is one of the major problems in the medical field in the Eastern Caribbean. It is the silent killer.
Incidence of hypertension among our elderly population over 65 can be as high as 70%, 75%. And in persons over 24, 25 can be as high as, say, 35, 40%. And these are figures which we know are not good.
Standardized hypertension treatment project sounds like a mouthful, but it's actually a very simple project. It uses a standardized method for the management of patients with hypertension, which involves three basic things: the availability of core medication, the use of a standardized treatment algorithm, and the implementation and strengthening of the healthcare system. The two pilot sites, one of which is right next door, the Winston Scott Polyclinic, the other the Edgar Cochrane Polyclinic. We enrolled some 30,000 patients, and the project lasted over just about 2 years.
Previously, managing hypertension was whatever you felt like doing, whichever drug you thought you should use next. After the project came online, there was a protocol. So you knew that if you had this specific value of hypertension, then what you needed to do was move here, check these factors, and bring the patient back in a given time and what the next level would be.
You found that sometimes one doctor might use one drug, another doctor might use another drug. So there's nothing really standardized to say, let's get everything in order so that we can treat our patient and see how they can be managed better.
The assessment part of the project, of course, is funded by the CDC, the Center for Disease Control in the United States, and PAHO, through our non-government organization, the Healthy Caribbean Coalition, who we are grateful for their efforts in terms of coordinating the project. The overall funding of the resources, however, is the specific responsibility of the government of Barbados, the Ministry of Health.
Important aspects that the HCC has been involved in is trying to obtain greater participation and involvement by the patients. We've also been involved in trying to obtain greater participation by the relevant health NGOs, the Heart and Stroke Foundation of Barbados.
We have civil society, we have academia, we have CDC, we have the member states, and we have PAHO. And these actors together are working to ensure that this project reaches its objective, and that at the end of the day, we have a standardized protocol of care in most of the islands of the Eastern Caribbean.
We created a hypertension registry, which is another core output. And so at the end of the 2-year period, we were able to see approximately a 14% reduction in systolic blood pressure.
There's a greater awareness of the burden, if you will, of hypertension in Barbados, and the need to do something about it.
It is working for me, where I find that I have no problems now with high blood pressure. Yes, I'm hypertensive, but I'm controlled. I don't get the migraines, I don't get the dizzy spells any longer.
We've seen a great decrease in blood pressures. There's still a few that you would like to tighten up on, but there has been some great changes. Behind more patients exercising, the blood pressure is more controlled. So yes, great developments.
We're not going to go into this with blinded by the idea that we're going to see results tomorrow or next week. But if we can get our population educated enough to understand how much we can contribute as a people to our outcomes in respect to non-communicable diseases, well, then we'll win the battle.